Welcome to the Natural Way to Better Health and Wellness. I'm Dr. Donald DeFabio. Nutrition, what to eat, what not to eat. Are vitamins safe? Can you take a vitamin and be concerned about it making you sick? Well, those are the things we're going to talk about, as well as how chiropractic relates to nutritional health care. My guest today is Dr. Steven Zatkoy. Thanks for coming out today.
Happy to be here.
Now, you're a chiropractic doctor also, correct?
I'm a chiropractor and a board-certified nutritionist.
So as a board-certified nutritionist, that means you have some extra training in nutrition, correct?
Yeah, I have thousands of hours in clinical nutrition, and clinical nutrition is basically using vitamins, herbs, and diet to improve a person's health.
Now, as a chiropractic doctor, how does that fit into your everyday practice?
Oh, I think the two things are, bonded together. As a chiropractor, we're trying to improve a patient's health, not just get him out of pain. And a lot of times, nutrition just speeds that process along. Somebody with, let's say, inflammation in the low back, where regular chiropractic care on its own may take 12 to 16 weeks, with proper nutritional balance could get it down to 8 to 10 weeks.
Wow, that's fantastic. So I want to talk a little bit more about chiropractic and nutrition in specific conditions in a moment, but let's just get a brief overview on what can a patient expect from their chiropractic doctor relative to nutrition.
Well, chiropractors are the best educated to offer nutritional advice. A big part of our education is spent on learning how to use proper vitamins and herbs to improve the body's health and to improve the chiropractic experience. Whereas other professions really count on drugs and medications, we take the more natural approach. Vitamins, herbs, good diet, healthier lifestyle, all those things go together. Mm-hmm. To say that a back pain or a headache or a stomach problem is related to one issue, or that God forgot to give us Zantac, doesn't really quite make sense. Mm-hmm. Vitamins, herbs, chiropractic care, lifestyle changes makes a lot more sense. Doesn't mean that people don't need medication, we just don't need it nearly as often as it's prescribed.
Now, that was a pretty big statement, that chiropractic doctors are the best able to provide nutrition for their patients. Can you back that up?
Yeah, it's actually pretty easy. About a year ago, chiropractors were given the right to practice nutrition in the state. We had it a long time ago, we lost it temporarily, and then we regained it back with the change in the laws, scope of practice. And in order to get that, I was called up, and the representatives of the New Jersey Chiropractic Association were brought up to testify. And we weren't the only ones. They invited everybody to give their opinion on whether...
This is about expanding the scope of practice to include nutrition for chiropractic doctors.
Nutrition and other things, correct.
Okay.
But these are open forums, so every group gets to give their comments. And I was lucky enough to be there. And the Nurses Association got up and said, we don't know enough about vitamins and herbs. We don't think they should be recommended. The registered dietitians who are supposed to, quote, be the experts, say we don't deal with vitamins and herbs, so we don't think they should be recommended. Same thing for the family physicians, the surgeons. Basically, for about 2 or 3 hours, all these groups and special interests got up and said, we don't know enough. We don't know how it's going to interact. We don't know what it's going to do to people. And then the Chiropractic Association representatives got a chance to speak. Steve Clark, our president, got up and basically said, we are educated in how vitamins, herbs, and nutrition affect the body. We know how it's going to work, so we should be the ones to recommend it. And basically it passed. We had about 3 hours of people fighting against it, and about 5 minutes of us arguing for it, because we are the only ones who will admit we are educated and we know, and we do. Mm-hmm. And it's done throughout the country, mostly by chiropractors. That's
great, and I hope our viewers really grasp that concept. Now, before we talk a little bit more about conditions, let's talk a little bit about safety. Is it safe to take vitamins, minerals, and herbs?
Oh, it's extremely safe. It's estimated that 40% of the American population takes a vitamin and about 20% takes some sort of herbal supplement on a daily basis. That comes out to 44 billion dosages a year. That's a lot.
That's a lot.
And the Centers for Disease Control have absolutely no record of a death being caused by vitamins or herbs that were taken properly.
So it's okay to not only take your vitamins and herbs, but it's okay to take an extra one if you feel you're a little run down.
Right. I see this all the time in my office. Patients go, oh, it says 300 times their recommended daily allowance. Is it safe? I'm taking something else, or I like to eat orange juice also. And it's extremely safe. First of all, the recommended dairy allowance is to make sure you don't end up with a disease like beriberi or pellagra. That's like basically to keep you alive, not what's needed to keep you healthy. The second part is when it says 300 times the RDA, that doesn't mean you're absorbing all of that. It has to go through the digestive tract, and you may only be absorbing 10 to 20% of it. So you can go above the RDA quite safely. And most herbs are water soluble, so what your body will take what it could use today and release the rest of it.
Mm-hmm. Wow, a lot of great information. So chiropractic is involved with nutrition. Nutrition is safe, just like chiropractic's save.
Extremely
so
safe.
They go hand in hand together. We're going to take a short break, and then when we come back with Dr. Zotke, we're going to be talking about how chiropractic interacts with different health conditions and nutrition. All right? We'll be right back.
Could that textbook your child just tossed into his already bulging school backpack be one book too many? Or how about that handbag of yours? Is it dangerously heavy? If you answered yes to either question, you could be setting yourself up for an injury. Dr. David D'Oliveira of the not-for-profit Foundation for Chiropractic Progress explains.
Heavy bags can strain your back, arms, neck, and shoulders. That's why handbags should weigh only a pound or two, and backpacks no more than 10 to 15% a child's own weight.
Aside from carrying only what you absolutely need, other preventive steps include using handbags with 2 shoulder straps, choosing backpacks with padded straps, and generally speaking, remembering to bend your legs when lifting anything.
It's all about reducing your risk of pain, numbness, and possibly even arthritis flares.
If you still develop pain, a chiropractor can help identify and treat it. You can learn more at chiropractic.com.
Welcome back to the show. Doctor, you just mentioned something while we were on break about the safety of chiropractic and nutrition. Could you relate that to our viewers, please?
Sure. One of the things we hear all the time, is chiropractic safe? Is it all right if I have my neck adjusted? Is it really safe to take my vitamins? I'm on medication. And I try and explain to people, the safety of it, but it's hard for people to visualize because there's tens of millions of chiropractic adjustments done every year without a single incident. There's 44 billion doses of vitamins and herbs taken every year without, an incident. And basically the easiest way to think about it, if you were to take all the vitamins and herbs ever taken and all the chiropractic adjustments ever done in the last 100 years.
That's a lot of supplements and adjustments, doctor.
That's a lot of treatments. It's still safer than getting a can of soda out of a vending machine. There are actually 16 reported deaths from people dying from vending machine falling on them. So it's extremely safe. It shouldn't even be a question.
Well, that's, again, a great story, and I want to relate that. Now, in terms of what to take, what are some supplements and herbs, vitamins that would be good for most people to take for health, wellness, and overall well-being?
It's amazing. Because I do a lot of nutrition, I get patients from all over. New York, Pennsylvania. I've treated patients all around the world. And more likely than not, people are walking in with more stuff than they need. When people get involved with vitamins and herbs, they tend to hear something on the news, they run out and buy it, and they grab it and they bring it in. They walk in with shopping bags. And they're amazed that they walk out with 2 or 3 key things. Because again, we're using vitamins and herbs. Chiropractors are using vitamins and herbs to heal the body and to help the body heal itself, not control the body. The body wants a little help. It doesn't want to be pushed around. And so some of the basic ones is I always recommend a multivitamin, a multi-nutrient. So it should have a vitamin in it, some minerals in it, some essential oil, some good bacteria, and then some phytonutrients, some greens in there. And that's a great solid base. And there's quite a few companies that carry that. And you use that as your base. And then if you have additional problems, you add to that. So if you're over 40, you may want to add some extra fish oil, up to 3 grams a day. That helps cut down inflammation. It's good for the heart. It's good for the brain. It's good for the skin. Those are great ways to go. And then, again, also diet is very, very important. So we're always focusing, don't just use the herbs and the vitamins, it's lifestyle. You're never going to get the nutrients you need or the health you need out of a bottle, whether it's a drug, a vitamin, or an herb. You need to participate in your health, and that means, exercising and eating properly, fruits, vegetables, whole grains. But for the most part, we always recommend a good multivitamin. and then we'll add some extra omega fish oils, maybe some more probiotics, and then a lot of these condensed green nutrients are excellent because it helps the body heal itself on a cellular level by turning it alkaline, which is much, much healthier than acid, which is inflammation and pain driven.
Well, that's a whole nother subset of nutrition now,
Sure.
getting this acid alkaline balance. Is that controversial, or is that pretty well established in the literature, this, acid alkaline thing?
It's really well established. I mean,
and what's the basic concept of it as well? Because that might be new to a lot of our viewers.
the basic concept is that you could check how your saliva and your urine and to see if it's very acidic or alkaline. Acidity is associated with inflammation, and inflammation is pain. So arthritis is inflammation. Degeneration is inflammation. Alkalinity is calming and soothing. It's sort of like, if you had more stomach acid and it gets out of control, you have pain. If you have inflammation in a joint, you get redness and swelling, you get pain. You strain a muscle, there's redness, there's swelling, there's pain. That's inflammation. So dietary changes towards an alkaline diet are soothing and healing, and they'll give the body the basic nutrients it needs to function. The interesting thing is, it goes back to what your grandmother told you. We all know it. Fruits, vegetables, whole grain, water turn you alkaline, bring down inflammation. Soda, coffee, white flour, too much meat, all are inflammatory and cause more pain. So it's all the basic stuff that we're preaching for years, and now it's just put into a nice book or a graph where you could actually see fruits and vegetables of this type are very alkalining. And it's funny, it's all the stuff, broccoli, really, really good. Strawberries, good, but not nearly as good. Spinach, extremely good. Watermelon, good, but not nearly as good. Chicken, bad, but not nearly as bad as red meat. Whole grains, good. White flour, not good. So it really follows common sense, but when people can look at it, they can really understand it. The thing I like about it, for $10, you can go to the store and buy pH paper, and every morning check your saliva and see where you're at. And if it's towards alkaline, which would be dark green or blue, you're healthy, you're getting the right amount of vitamins and minerals in your system, and you're doing everything right, so it reinforces it. If it's yellow, then you really need vitamins and minerals in your system, and you need to change your diet to get that vitamins and mineral, the alkalinity up. And it correlates. I've been doing this for 20 years in my office. You get people with fibromyalgia, which is uncontrollable pain, inflammation, digestive problems. They are always extremely acidic. As their levels and their pH level goes up and they change their diet and they take their nutrients, their pH level goes up, their alkalinity goes up, their pain drops down, and they feel fantastic. And it's been studied for 100 years, and there's really no controversy at all. It's really a great way to understand how your body is working. And what's good about it, again, it gives control back to the patient. They can check themselves every morning and see where they're going.
How much time should they give themselves to see a change if they really work at it?
Well, pH paper is a logarithm, so it takes a lot to go from 5.2 to 5.5. The thing is if you're 5.2, you're so vitamin mineral deficient that making little changes will move you up quickly. But you'll see a nice change in 30 days.
Okay.
It may take you a year to get from
Really
the
make
real
a big
bottom
change
to normal. But you gotta remember, during all that time, you're feeling better, you're feeling healthier, you're feeling stronger, which means you're going to exercise, you're going to lose weight, and you build positive momentum rather than negative momentum. And people know it all the time. It's going to either be a positive day or a negative day. If you start the day off with a cup of coffee and a Danish, I guarantee you're not moving to fruits and vegetables. You're going to have
That's what Jack LaLanne was all about. People are having a cup of coffee, a Danish, and a cigarette in the morning, and they felt crappy all day.
Exactly.
So,
you start off on the bad pathway.
Exactly. Dr. Z, we're going to take another short break. Then when we come back, let's talk a little bit more specific about some health conditions, like you mentioned in the very beginning, that chiropractic and nutrition go hand in hand beyond just an acid alkaline diet. How's that sound?
Sounds great.
All right. I'm Dr. Donald DeFabio, and we'll be right back with Dr. Z about nutrition, chiropractic, and how it can help you.
A healthier you can be a lot easier to achieve than you think. Often the most effective way to improve your health is to make consistent, small, positive changes. According to experts at the Foundation for Chiropractic Progress, it's best to try to balance your diet, emphasizing fruits, vegetables, whole grains, and beans, reducing or eliminating your intake of harmful foods like sugar, soda, fats, and processed foods. Drink plenty of water, especially in the hot summer months. And remember, a nutritious breakfast is the most important meal of the day. You don't have to run a marathon to shape up. Just do some form of exercise regularly. Aim for 20 to 30 minutes, 3 to 4 times a week. Learn how to stretch properly, walk with supportive shoes, and lift some light weights. Attitude matters too. Staying optimistic can lead to greater success in a goal of a healthier you. Chiropractors are experts on wellness and can offer lifestyle advice. For more tips, visit yes2chiropractic.com.
Wow, a lot of really good information, a great show. Let's get a little more hands-on, so to speak. Dr. Zodkoy, if someone were to come in with arthritis in your office, what would be some of the nutrients you would suspect they would need?
Arthritis is really common, especially with the aging population. Again, I start everybody off with a good multi, make sure they have a base, discuss the alkaline ash diet like we already talked about. But then there's specific stuff that seems to work extremely well. Boswellia is a very, very powerful herb that cuts down inflammation. Great, safe, no interactions. Quercetin, another one, safe, easy to use, doesn't upset your stomach. Quercetin, another one, great to use. And these are known as BCQ, and you can see them in good combination. And really helps to cut down the inflammation.
What about Devil's Claw? Is that one of the ones?
Devil's Claw is another one that's great. MSM, with is a methyl donator, which brings down inflammation in the group.
Quick story, one of my patients came in once and their hands were all orange. And we couldn't figure out what it was, and it was from a little bit too much MSM, but it wasn't a toxic reaction.
No.
And they just cut back on it, and they were fine.
Great.
So, again, that safety issue.
Again, and as long as you take a reasonable dosage.
Oh, she was taking a lot.
Yeah, as long as that doesn't usually happen. But again, when I'm recommending something for arthritis, I'll recommend, again, something that is a combination. Boswellia, quercetin, curcumin, and MSM, Devil's Claw. There's a combination at once because you never know which one's going to work with a person. Yeah. And they usually work synergistically. A little bit
together.
Together, yeah. So, you know, instead of people are really big on glucosamine, that only works for a small group of people. Yeah. If you have 4 or 5 of these things together, you really have a very good chance of it working. And the other thing is they have to give it a chance. It took 20, 30 years for this arthritis to flare up and cause a problem. You got to give it 30 to 60 days for it really to start to calm down.
Now, how can people get in touch with you if they have more information? Can they contact you directly? This is a lot of good information.
If somebody has a question, my office number is 732-308-0099. Or the best way, really, honestly, if they have a question, is szodkoy, SZODKOY @hotmail.com.
Great, thank you. I'm sure you're going to get some calls. Now, let's try headaches. Headaches, a real common condition. I know I see all the time. Does that respond to nutrition as well?
It's amazing. I've been treating headaches and migraines for 20 years. I was a migraine sufferer, and the reason I actually really got into chiropractic and nutrition is chiropractic was the only thing that gave me relief. And then when I went to nutrition, they basically just totally disappeared.
Nice.
About 15 years ago, I wrote a research paper on treating migraines with nutrition, and basically found that my theory was that there was a flaw in the person's detoxification system. And now with genetic testing, it's actually been proven that people with migraines have a genetic flaw, and it has to do with how the body converts certain vitamins into a usable form. So if you were to give a patient magnesium, active form of folic acid, some coenzyme Q10, and several other nutrients, you could really wipe out migraines. I have a 20-year history of 100% success with migraines.
Wow.
And headaches, the same thing. Headaches usually have a spinal undertone where the neck is out of alignment and there's pressure on the nerve, but that also comes with ligament laxity. And ligament laxity is why people wake up with the headaches. And nutritional support like glandulars help a lot, magnesium help a lot, and it helps not only get rid of the headaches, but helps them hold the adjustment so their overall health is better. And that's where you really see chiropractic and nutrition coming together. Adjustments are great. You add them with nutrition and they're fantastic. It really speeds up the healing time.
It enables the body to heal quicker, more effectively and naturally, which is what we're all about as natural healthcare providers.
Exactly, and I think that's where everybody wants to go. We see the failure with the healthcare system of forcing the body to take a drug, and we're trying to find a more effective way.
I've always thought my headaches were from a Tylenol deficiency.
Yeah. That's probably what it is.
I thought that's what it was. Yeah.
You know, let me real quick. You know, people. We were talking about safety before, and you talk about Tylenol. Again, there was no reported deaths from the Center of Disease and Control, but there were, I think, 152 from Tylenol and 55 from aspirin over the last year, and that's pretty consistent.
Year?
Last year.
Wow. I'm glad. I'm sticking to vitamins and minerals. Hey, one more condition before we take our next break: fatigue. I see it again a lot of time. I just don't have any get up and go, doctor. You know, what about nutritional tips for that?
Fatigue is, you know, one of these things where you really need to make a change in your lifestyle. Again, the alkaline diet, a good multivitamin. But some of the people you actually see, especially the older ones who are having a hard time with just the breathing and walking, coenzyme Q10, 100 milligrams, 200 milligrams a day is great. It'll bring more oxygen, more energy into the body. Again, the alkaline acid diet is fantastic. And one of the simplest things to do is something called brewer's yeast. Brewer's yeast has been around forever. It's what they actually use for beer. I remember taking
that in high school, yeah.
And it's very, very nutrient dense for vitamins, B vitamins, which will give you a lot of energy, and amino acids, which will help keep your body strong. And here's something that, you know, costs pennies a day, but totally energizes the body. And when we have cancer patients, who are really worn out and fatigued, we try and get them on the brewer's yeast because it energizes them right away.
You know, I got to admit, whenever I found out back in high school when I started taking brewer's yeast because my brother was taking it, how much better I felt. Then you get lazy, you stop taking it, and every time I go back on it, I feel much better.
It's an amazing food.
Yeah, I'm a big on that. So here, what do we have? Eat right. Alkaline diet.
Alkaline diet.
A good multivitamin, multiple mineral.
Great first start.
Greens drink.
Greens drink.
And then you have to start looking at your particular health needs. Sound about right?
Yeah, and I think, you know, if you start making these type of changes and you're not seeing the results you want, that's a great time to talk to your chiropractor about nutrition. Okay,
well, that's what we're going to talk about next. Okay, we'll take our last short break. Going to hit our Did You Know segment for today. And then when we come back, let's tie that up about chiropractic and the real nutritional training, you know, to help their patients. We'll be right back. Did you know that chiropractic care can successfully help you with the symptoms of gastric reflux, heartburn, and a hiatal hernia? That's right, natural chiropractic care can help those things. First of all, we have to look at diet and look at heartburn and gastric reflux a little differently. The medical profession likes to shut down the amount of acid in your stomach with Xanax and Prevacid and antacids, whereas natural doctors want to accelerate digestion with digestive aids to push the food out of your stomach quicker so that it's not sitting in there to reflux. Can work very well. However, a hiatal hernia is when the stomach rides up against the diaphragm and the food gets stuck in there or sometimes doesn't go all the way through. A very common problem, and well, it works really great to a manipulative reduction, which we're going to demonstrate now. So again, a hiatal hernia is when the stomach rides up against the diaphragm. So what do we need to do? We need to pull it away from there. Very simple, very effective. So what we'll do is bend one knee, bend the other knee. The rib cage is here, and right underneath it is the diaphragm and where the stomach comes through. Take a deep breath in and let the air all the way out. I just go right on top of the stomach. I hold it down gently. Take a deep breath all the way in, and as you breathe in and relax, the diaphragm raises up. I hold the stomach down. It separates the stomach from the diaphragm. The hiatal hernia resolves. Does it work? It works really well. How long? Usually get an excellent result in about 6 sessions. Again, dietary intervention may be needed as well. The chiropractic intervention for a hiatal hernia, a little different, but did you know it can really work? Welcome back to the show. We're going to finish up with our final segment. Dr. Stephen Zodkoy, you are the chairman of the Association of New Jersey Chiropractic Society, their
Nutrition Education Council.
Explain that to me.
Well, the association works extremely hard to get chiropractors the right, and actually, you know, the citizens of New Jersey, the right to good nutritional
I mean, beyond
advice.
The guy at the health food store or the gas station?
Besides the woman, you know, who cuts your hair telling you what to take. So they put a lot of effort into getting us the right to give you the information and a lot of effort in the right to patients receiving the information. And now we're spending all of our efforts educating and chiropractors, and I should say actually continuing to educate chiropractors on the advancement in clinical nutrition. I'm proud. I'm heading up the chairperson for the Nutritional Education Council, and basically what we do is we bring in physicians from around the country to teach seminars to doctors on how to reduce inflammation, how to treat GI problems, how to treat headaches, how to properly evaluate a patient to make sure there aren't going to be any drug interactions or side effects from giving herbs and vitamins and dietary changes. And it's fantastic. I mean, we've got courses on everything from stomach problems to headaches to inflammatory problems to note-taking. I mean, it's from A to Z to make sure that doctors are taught not once, not twice, but 3, 4, 5 times how to properly do things. And as we learn more, we continue to educate them. I personally teach 20 to 30 hours of continuing education in New Jersey, and that is pulled from hundreds and hundreds of hours I learn throughout the country. And there are just as many other doctors like me with advanced degrees, certifications, board certifications in nutrition, teaching other chiropractors around the state. We have the best education program for nutrition in the country, whether it be for chiropractors or medical doctors or registered dietitians. There's nobody who's doing more to educate their profession.
Well, thank you very much, and I appreciate it because I've been to one of your seminars and I learned a lot, and actually since then we've been using your pH paper, we've been doing the acid alkaline testing, and it has been working really, really well. So it's safe. We have had no problems with it, so you're doing a good job. Thank you very much.
Thank you.
I'm Dr. Donald DeFabio. Eat healthy, take your greens drink, and do what you can to improve the quality of your life naturally, without medication, drugs, and surgery. Dr. Z, thanks for your time. We'll look forward to seeing you soon.